So with that, I'm really, really excited to be able to present our winner of our biotech selection committee decided, and it's Jeremy Hammer. And Jeremy's going to come over and pitch. Thank you so much, Jeremy. We appreciate you. Congratulations.
Hi, everybody. Grateful to be here. I'm Jeremy from High Peak Medical Systems. We're a company dedicated to the prevention of false positives in blood culture. So the problem is that false positives in the emergency department, the detection of sepsis can be caused by this patient's own skin bacteria on the inner layers that can't be disinfected topically. And those contaminant bacteria can enter the sample and cause a false positive reading. So the impact of false positives, it's a $5 billion cost in the US. The increased average hospital stay is about 5.5 days per patient. There's unnecessary antibiotic administration and increased risk of hospital-acquired infections. And each hospital, on average per year, loses about $1.2 million. So there are 2 current products on the market that have been out for about a few years now that use a diversion method so that skin that was uptaken by the needle, that portion of that blood gets sidelined and then a clean sample is taken from that point. The device on the left, the Kieran device, has a really small volume. It's limited by the technology, and it can't fully take out all those contaminants, and so it's not clinically proven, not clinically effective. The Magnolia device on the right is clinically effective, but it's a very user-unfriendly device where there's a slow 10-second diversion time where they have to squeeze this piston. And what we found in interviewing multiple hospitals, about 6 of them that adopted the Magnolia product, is that they can only get 20 to 40% use compliance with their nurses to actually use the device because of its unfriendliness. So at High Peak, we came up with a device to fill in the gaps of those current products that are on the market. And we're just using blue food coloring in this demonstration to show that the contaminant portion of blood can be isolated. So the blood culture draw process starts as normal, which the nurse enters the vein, and then from that point, she can go ahead and with a quick activation of the switch, get that potentially contaminated portion of blood into the diversion chamber, which for these purposes has that blue food coloring, and then she's able to collect a clean sample from that point. And you can see here, just for demonstration purposes, the blue food coloring that's potentially contaminated on the right, and then the red sample on the left. So High Peak versus the competition, the big thing is having that diversion volume that's clinically effective and being operator friendly so people actually use it. And the total market opportunity with maintaining a 66% gross margin while undercutting the competition ASP by about 20%, with our quoted manufacturing costs is about $250 million in the US and then another $250 million in the EU. And there's a global CAGR rate about 9%, and CPT code reimbursement has been established. And so our US regulatory pathway is a Class 10 510K. Our financial projections have us cash flow positive at 2025. And the investment opportunity now is to get us to that 510K clearance milestone so we can go and sell into the market. And the round of funding is leveraging a contract manufacturer for design and development expertise with testing to get to that FDA clearance milestone. And then our exit strategy is a sale to market leaders. All 3 of these companies are big players, and they've expressed interest in just our pending patent applications. So, for summary, there's that unmet market need of both needing an effective and a user-friendly device. The competition has just entered the market in the past few years. They have about 3% market penetration, according to the sales data, and they're using their funds to educate the market. And we're looking to get to that 510K clearance milestone and enter the market. So the team, I'm Jeremy Hammer. I'm an engineer by training, designed to develop multiple medical devices, and then I was in business-to-business sales for 3 years, maintaining 168% of quota. Richard Sass is an advisor who's a serial medical device entrepreneur who's founded and exited multiple companies. And then Pete Murray's an advisor who is a former site executive for Welch Allen, has over 20 years of medical device experience, manufacturing experience. And then Elisa Thomas is our regulatory consultant who's led multiple medical devices through 510K clearance. So thank you to the Emerge program, because with that help, we're able to go ahead and fulfill our mission of preventing false positives in blood cultures. Thank you.